recent studies have shown that about 70% of patients are concerned about their body appearance. Abdominoplasty is an operation aimed to correct several problems on the mid-torso of the patient, to diminish the amount of excess skin, remove the stria, correct the flaccidity of the abdominal muscles, improve and diminish the waistline, lift the pubis, and remove the excess skin on the upper thigh. Although this is not a direct abdominoplasty surgery, but to some extent some of the distant structures are improved with a well-done abdominoplasty. A few years ago, I described the technique called abdominoplasty. This is an operation basically to match the length of the incision on the lower part with the incision made on the upper part to make a closure following the direction of the bikini line. This is a little bit more extensive incision than the one they use for the mini abdominoplasty. The traditional abdominoplasty is directed for those patients who have a significant contour deformity on the mid-torso, on the abdominal area, that addresses all the problems I have just mentioned. Mini abdominoplasty is an operation that can be done with a smaller, shorter incision, but this is done usually for younger patients who require a little improvement of the pouch or flaccidity of the muscle they may have, and they don't require significant mobilization of the navel, for example. So the operation is tailored to the patient's problems and patient's need, from the small abdominoplasty, which is the mini abdominoplasty, to the much larger abdominoplasty, which is the abdominoplasty. An extension of that is what is called the circumferential abdominoplasty. With this operation, we can address all the problems on the anterior abdomen, but also on the back, which includes the falling of the buttocks. So the buttocks are lifted, the excess skin around the waistline is removed, the thigh skin are lifted, so the effect goes all the way to the area of the knee. The mini abdominoplasty, as I mentioned, usually is for younger patients who had a minor contour problems with a shorter incision. So those patients, they look very good in bikini.